everyone. It's 10:30 and it looks like we have everyone on the call. I know we have some attendees still rolling in, but we will get started. One quick reminder, when you're sending in questions for our panelists, please make sure you send that to select the option for all panelists. Don't send those questions to the host, please, unless you need my answer on those, but I think there will be some specific questions better suited for others on the call. So with that, I will turn it over to Jeff. I'm going to unmute you, Jeff. There you go.
No, I got it. I was just getting ready to make fun of you and say Heike doesn't want your questions, but no one could hear my jokes. That kind of fell flat, and then I was double muted. So, joke's on me. Good morning, everyone. I'm Jess Bax. If I have not had the chance to meet you, Monday was my first day as the director for DD, and I am really happy to be here. I've had a great first week getting a chance to meet so many team members and talk to different stakeholders. So I am planning on staying as opposed to, we did hire a new fiscal chief, and Angie's next to me in the room across the wall here. So she can mute herself while she cries because she had a new fiscal chief that started on Monday morning the same day I did. And I think she stayed for an hour and a half. So that might be the shortest tenure ever, but the good news is Melanie Highland has accepted my former role as Division of Senior and Disability Services Director, and she'll be a great partner over there. So we're very excited about that. Have a lot of good updates and information for you today, a lot of it from the federal level. So excited to share that. One of the first things is that the American Rescue Act, the enhanced FMAP, so not sure how many of you are aware of that or how much it's been talked about, but in the American Rescue Act that passed, there was language that was specific to enhanced federal match for our programs specific to home and community-based services and the DD waiver programs that we operate, as well as other home and community-based services program operated by the state, including home health, the state plan personal care program, and the other waivers such as the traumatic brain injury that are operated over by health and senior services. There had been enhanced federal match available and federal dollars available in previous stimulus legislation, but this one actually took it a step further and said that there was enhanced FMAP to be dedicated to home and community-based services. And there was a little bit of guidance that kind of teased us in the American Rescue Act that basically said it was to expand services and support program expansion. But it really, and then it said that states, in order to earn that, would need to maintain their level of spending that they had in place as of April 1st of this year. And then we also knew that states who earned it would earn it from April 1st, a month and a half ago, so we've been earning it, until March 31st of next year, which by our estimates would put Missouri at around $220 million additional federal dollars for HCBS programs. So very exciting. That guidance came hot off the press yesterday. There's a 26-page letter from CMS to state Medicaid directors that is available. Just hit Google enhanced FMAP, HCBS FMAP guidance, and you will get to it. I have not had time to fully digest it, but it's very exciting to find out how we can invest in expanding programs and making sure that we have great services available. So I wanted to let everyone know that. More information to come soon. And in the realm of budget, I did want to give a final budget update because at this point, last Friday, the 7th, was the last day for budget, and it was passed out of the House and the Senate, and now will go to Governor Parsons' desk to be signed, and I wanted to talk about where the budget ended up for DD programs. Some pretty exciting stuff. There is also some interesting things, some things we didn't expect. So talking through a couple of points, and this doesn't encompass everything, but I wanted to hit the highlights. There was $166 million for DD rate standardization, and that takes the DD rate standardization for the RES-HAB to 100% of the FY20 lower bound, which is achieving the corrective action plan put in place by CMS. Now we all know the rates need to be above that in order to address things like minimum wage and competing in the market. But it is a great win to get that money and be at 100% of FY20 lower bound. Of that, $56.6 million was funded through the enhanced federal match that I mentioned earlier that passed in the American Rescue Act. So what that means is next year, when we go through the budget process, we will have to make sure and educate that there needs to be general revenue put in place of that in order to continue that rate and make sure that we're paying what we need to be paying, as well as discussing the need for additional funds to compete in the market. So I'll talk through the others. There was $9 million increase to the PA rates. So that is a rate increase that is based on a Mercer rate study that was done for personal care over in health and senior services. So it essentially took those services to the lower bound of that market rate study and then gave a 5.29% increase on top of that. So $5.28 per unit for agency model, and self-directed was $3.86 per unit, $5.99 for medical. Partial of this has that same enhanced federal match, and part of this was general revenue. So kind of same issue there in a partial way. There was a $211,000 increase for autism service rates, also increased in the state plan. There were $6.2 million put forward for a 5% rate increase for all day services, so including day hab, employment, and community integration. And that was general revenue. So very exciting for that. $75 million was put forward to make sure that there are no wait lists. There was $4.5 million put in for Station MD to be continued to be available, which we're very excited about. $4 million of general revenue was put in place for an EMR for state facilities. $2 million for a patient post-discharge program. $250,000 for a training pilot program for DD, and $50,000 for an autism transition center in Kansas City. And I'm sure we'll have much more detailed updates to send out on those final budget highlights after the governor has signed those, but I did want to give you that update. In the realm of waitlist, just wanted to give that update. No slot assignment limit, of course, effective April 1st. We've mentioned that before on these calls. Currently, on the in-home waitlist, there are 383 individuals. 23 of those are out of 12. So really, it's just a matter of working through that wait list at this time. And there are 62 on the residential wait list. Since I talked about budget, I did want to mention what a great impact the information from the NCI Staff Stability Survey has in helping our budget committees and our partners over in the legislative branch understand what's truly happening at the ground level and how rates affect the DSP wages and the turnover and the ability to hire staff and make sure that we have enough well-trained quality staff in those positions. So while I wasn't with Department of Mental Health DD this year during budget, I was with you because Department of Health and Senior Services budget is in the same House bill, in House Bill 10. So I did get a chance to sit through those budget hearings, and it was really cool to watch because we don't have an NCI staff stability survey on the aging and disability side of the House in state government. So to see the faces of legislators as they were hearing the information and the really good data that comes out of that survey that tells the story of the need for a rate increase was pretty cool to watch. So information is out there right now about participating in that. It needs to be completed by June 30th, and I think emails were sent out, and it's available on the website for anyone, and we really encourage you to participate and spread the word and appreciate those who have already done so. Switching gears just a little bit, we are going to have Station MD on the call today, and they are going to talk about some of the new information available on vaccinations, and now that we have vaccinations available for a different age group, which is very exciting. So I'll leave that for them. But I did want to just kind of mention that we're very excited about that. The other two things I wanted to talk about today are both things, again, really from the federal level, but that affect us and are really great benefits for Missouri, for the people we serve. And this is something that I talk about kind of wherever I go, both in my previous role and here, because while data may not be exciting to everyone, data is exciting that in the way that it gets us to a place that we have not been prior. And one of the things that's so exciting about the Health Information Network onboarding program, which is through MoHealthNet, and there's information available on MoHealthNet's website about that, and there's been email blasts that have gone out about that. We're really hoping that providers take advantage of this because it is a chance to have this at no cost paid for, to have an integration between a provider system and a health information network, meaning that there is integration where what we all know to be true is that you need to have the medical information to make a good service plan and to deliver care in the right way. And the medical provider really needs to know what's going on with someone's service delivery to understand how it's affecting their medical care and what information that person needs. And this opportunity allows that to happen. So the funding ends September 30th. So you have all summer, our providers have all summer to get data geeked out and get in on this opportunity to have this paid for. So just wanted to put a shout out about that. Let us know if you want more information. And the last thing I wanted to talk about before I turn it over to, I think Leslie is going to talk next, is the EBB, so the Emergency Broadband Benefit. And this is, the federal government wants to help people with internet. They have recognized the need for internet in so many aspects of life being important. It basically affects every social determinant of health, from education to healthcare. Having internet makes better outcomes. So starting right now through the end of the funding running out, basically there is availability of $50 per month per household for qualifying individuals. So anybody who's a DD client, that household would qualify. And I'll kind of talk through, Heike has the the website pulled up here on Do I Qualify? So making sure that everyone in our world is aware of this benefit and is accessing it is super important right now. And so there's this great website that talks about Do I Qualify, and it walks through, first of all, you can qualify if you're at 135% of the federal poverty guidelines, and it has a link there to check that. Or there is kind of this easier path to say, to help people understand whether they qualify. So if you're already getting a Lifeline benefit, or if you're already participating in SNAP, Medicaid, SSI, public housing assistance, veterans and survivors pension benefits, if you already are getting any of those benefits, this is something that you qualify for. I won't talk through tribal because we don't have any tribal programs in Missouri, but there's also you may want to check this out if you've had a substantial loss of income since February 29th of 2020, so basically since the beginning of COVID, for your total household income in 2020. And those guidelines go pretty high, so that's something to check out. If a member of your household receives free or reduced school lunch program, that's an indicator that you qualify for this. And the way that you qualify is, or the way that you access it is pretty simple. It walks you through it on the website. I kind of walked through it myself yesterday just to test it out. There is kind of two pieces. You walk through online, and there's a mail-in option as well. Walk through online and sign up, and then you have to let the internet service provider that you currently work with or that you plan on going through know that you qualify for the program and plan on using it. And yes, there's an Apply Now button at the bottom of that link, and usually takes about an average of 2 days to get notice of whether you qualify, confirmed, and then the $50, it's really cool, it goes straight to the internet service provider. So it's automatically deducted from the bill or completely takes care of the bill depending on the cost of the internet service provider in the area. It looks like Heike has posted the link in the chat. Great, thank you so much. If anybody has any questions, let us know. Very exciting benefit to be available to individuals right now, especially as we go into the summer months where some kiddos won't have access to school that had been during the previous time period. So with that, I'm going to turn it over to Leslie for the next portion of the updates.
Thanks, Jess. So just a couple things. On May 7th, CMS stopped the 90-day clock on the comprehensive and community support renewals and the partnership and MOKIT amendments to align with those renewals, and issued a request for additional information, or RAI. So the state is working with CMS on responses to the RAIs, and the clock will remain stopped until the state submits its responses to the RAIs. And once the state's responses are received by CMS, a new 90-day clock will start. The Partnership for Hope waiver amendment to increase Factor C unduplicated number of participants from 2,500 to 2,875 for waiver year 3 was approved by CMS on May 7th and became effective April 1st of this year. And that's all I have. Thanks.
Leslie, this is Kim Stock. Good morning, everyone. Just had a few quick updates for everyone on the health risk screening tool process. We're very excited to be moving into the implementation phase of utilizing the health risk screening tool. Right now, phase 1 is for volunteer agencies that are interested in coming on board now to give us some invaluable feedback so we can do even further enhancements to our process before we go full statewide implementation in the fall of 2022. We have updated our process document that Heike has pulled up. Thank you, Heike, on our designated webpage for the HRSA process. So please take a few moments to familiarize yourself with our process if you've not already done so. And as always, if you have any questions, we do have a designated DD mailbox for the HRSA process. Please submit your questions. We greatly appreciate those. We are finalizing a FAQ document right now that will also be posted out on our HRSA process landing page. We also have posted for you recently from Intellectability, which was formerly HRS Incorporated. They have developed a little bit over 7-minute video recording that's really targeted towards individuals receiving services and their caregivers and families about why Missouri DD is utilizing the HRST process and the importance of doing health risk screening and then enhanced planning to mitigate any identified risk. So we have some resources available, and again, just wanted to remind everyone where we're at with the process and that we look forward to hearing from everyone and can't wait to continue moving forward with utilizing this tool and enhancing planning for everyone. And so with that, I think I will turn it over to Wendy Witzig to see if she has any information for everyone today.
Kim.
Go ahead now.
Okay. Hi, everybody, and thank you, Kim. I just have a couple questions that I wanted to speak to that came into the DD mail. The first one is, what is required in terms of monthly documentation for day program clients who are not attending day programs throughout the COVID pandemic? Are monthly reports still required to state that no services or supports were rendered to the individual that month, or is this not required? The monthly report is still required because their ISP plan shows that day program has been approved even though they're not receiving it. So we want to be clear that they're not receiving it because of the COVID pandemic and they're just currently not attending. So it doesn't have to be much more of a statement than that, but we do want to have that statement in there so that it is clear. The second question is, furthermore, are case managers required to sign and date the monthly report after reviewing? In the past, this has been something that has was looked for by LNC as well as other case managers. However, now in the age of electronic report sending, is the case manager's signature no longer necessary? So that really is going to depend on if the form that it comes in on has a line there for the support coordinator's signature. MAC, when they come in and audit, they're going to look to be sure that the documentation is complete. So if there is a line there that requires the case manager to sign, it needs to be signed. The documentation that the support coordinator has reviewed the monthly summaries is a part of actually their monthly reporting. So it's not dependent upon what the monthly report form has on it, if it requires a signature on that form or not. That's kind of what's been set up in terms of the provider or between the provider and the TCM. So I hope that helps. If not, please enter a follow-up question in the chat or send it to the DD mail and we will refine the answer and get more information out to you. Thank you. So Jess, I'm going to turn it back over to you if it's time for Station MD or.
Yep, awesome. Thanks, Wendy. Yep. Great question. And yes, it is time to turn it over to Station MD for a great update.
Hi, can you hear me okay?
Yes, we can hear you great.
Okay, great. Thank you. First of all, thank you guys for having me. I really appreciate it. I was just going to real briefly talk about the recent news about vaccinations in adolescents, and happy to answer any questions that I'm able to answer. It's relatively new news, and we, in general, I think the public is excited about it. But it was just announced by CDC about, well, I think 3 days ago. Essentially, what they have approved now is the vaccination for the Pfizer vaccination for children 12 to 15. The dose is the same. It has a very good safety profile. This has been carefully vetted by the CDC. And the thought process is there's about 17 million or so children that fall into that age range. Up till now, it has been only given to individuals over age 16, and that varies in some states. Most states, and Missouri, I don't know the specifics, have adequate vaccination now on hand to provide that to those individuals. But the thought process is that, we are just increasing the number of individuals that are vaccinated, and any host that the virus can take hold of we want to diminish that. So increasing that population, just getting those children vaccinated, I think is important. I do think it will help us kind of return to normalcy in general. I do think the safety profile of the vaccine has been proven in this population. Just anecdotally, what I've heard is there is only been a slightly increased rate of fever in children this age, but outside of that, all of the side effects are the same as they are in adults. And just for your understanding and edification, um, there have been about something on the order of 1.5 million children that have been infected by the virus to date in the United States, and about 13,000 of them have been hospitalized. Although the virus is less virulent, meaning the impact of it is less in children, it is not. It's not without some very minor but serious side effects in a small segment of this population. So I would encourage you, if you have family members in that age range, or if you have questions, we're happy to answer questions, but to speak to your pediatrician about that. It was, again, just recently announced, and my understanding is that some states have already implemented, but you just really have to check your local health department and local jurisdiction to find out if the vaccine has been approved for that segment of the population. Um, and then the other thing I wanted to speak about is just regarding Station MD in general, and just to make people aware of some of the other aspects of the service which you may not be. If you know about some of this, I apologize. I know I may be preaching to the choir to some individuals, but our goal is really to get the word out that we are there to support you and to support individuals that you serve. We're started under the kind of height of the pandemic, with the hope of really keeping people safe and in their home setting. But aside from doing that, we are way more robust than just that. We are there to help and answer your medical questions, address any medical concern. The overall kind of mantra is that if you're not sure when to call us, just call us. We are there. Some of the things that we have been in providing some of the individuals that we serve is medication refills. Sometimes it's difficult to reach a physician, or it takes a while for them to call back, and they may not have the same capacities we do. So we're happy to do that. If you have an individual that needs an urgent medical need or a minor issue that needed to be addressed, we're happy to do that. And some of those include falls and cough and rashes. So I just want to kind of reiterate that we have that capacity, and that we are there, and the state has been really progressive in providing this service for you, and we want you to use it. One of the other common calls that we get are just questions surrounding COVID and can someone return to their day program, or how do we cohort individuals? So I just want to get the message across that we are there. We haven't gone anywhere. We started under COVID, under the pandemic, but really we are there, and hopefully we'll be there for a while to help support you and support the individuals that you serve. If there's any medical concern or question you have, please don't hesitate to contact us. We are excited about the partnership and excited to stick around. And what we're trying to do is increase utilization in some of the sites that aren't using us as much and that need us, and that may not know about it. So if you have any questions, please you can contact us through Station MD directly, or you can contact the Department of Mental Health, and they'll get you to the right person to answer your questions. I know we have Megan Kalishman on. I don't know, Megan, if you had anything else to add, and if not, I just want to thank everyone and appreciate your time.
No, I didn't have anything to add, but just to reiterate, if people have any questions about the onboarding process or using the service, feel free to reach out. I know the division has all of our contact information, and we could probably get it into send it in the chat as well.
Great. Thank you.
Yeah, thank you. Really appreciate that great update. There were just a couple questions that came through the chat that I wanted to talk through. So one individual was looking for the DD mail address, and Heike threw that in there. Thank you. one of the other questions that came up was just some misunderstanding about the monthly summary and no services being provided. There were actually two different questions about that. So a good reason for the confusion here is that the requirements are coming from two different directions. So while MAC is really looking for a signature to document when services are provided and verify that, there is also the aspect of waiver oversight of the individual and the services being provided. So the documentation needed for individuals when their service is not being provided and why on the monthly summary is really something that has to do with oversight of the waiver, whereas there wouldn't necessarily need to be a signature in that circumstance. There just needs to be the documentation there. So hopefully that clears up confusion, but if I made it more confusing, feel free to send in questions to DD Mail and we'll take the time to address them. Thanks. Okay, I'm not seeing any more questions pop up, so we hope everyone has a great weekend, and we will see you soon.
Thanks. Bye-bye.